Welcome to the Explainer. Finding a lump somewhere on your body, it can be pretty scary, right? You immediately start wondering, what is this? What happens now? Well, today we're going to pull back the curtain and walk through exactly how doctors solve that mystery step by step. All right, let's just jump right in. Finding a lump you weren't expecting? Yeah, that can really send your mind racing. But for doctors, it's actually the beginning of a very methodical, very logical process. Think of it like a journey, one that's designed to take that worrying discovery and turn it into a crystal clear diagnosis and, most importantly, a solid plan. So to really get a feel for how this all works, we're actually going to follow two different cases. These are the kinds of classic scenarios doctors see all the time. Two different people, but they both start with the exact same problem, a mysterious lump. Okay, so let's meet our two patients. Case number one is an older gentleman with a swelling right below his jaw. Case two is a middle-aged guy with a similar sized lump, but his is in front of his ear. Now, even though they're in different spots, and trust me, that location is a huge clue, the way doctors start investigating is pretty much the same. So, where do we begin? Well, the very first step is a good old-fashioned physical exam. Seriously, you can think of the doctor as a detective, gathering those first crucial clues right there at the scene. And it all boils down to two things, looking and feeling. First step, the doctor just looks. Simple, right? But it tells them a lot. In both of our cases, what they see is a single, smooth, kind of oval-shaped swelling. The skin over it is stretched a bit, sure, but it looks normal. No redness, no breaks, no weird scars. It's like this self-contained little package under the skin. And that, right there, is a really good initial sign. It suggests whatever's in there is probably not aggressively trying to break out. Next, the doctor uses their hands to feel the lump. Is it warm to the touch? Nope, so probably not an infection. Does it hurt when they press on it? Not at all. And this is a big one. When they gently push it, it moves around. It's not locked down or stuck to the deeper tissues. And let me tell you, that mobility is a massive clue. It usually means the lump isn't invading everything around it, which is exactly what you'd worry about with something more nasty. Okay, after the look and feel comes a crucial nerve check. The doc will ask the patient to do a bunch of facial expressions. Smile big, frown, squeeze your eyes shut, just to make sure all those little facial muscles are firing correctly. They'll also take a peek inside the mouth to check if saliva is flowing normally. And guess what? In both our cases, everything's working perfectly. This is another really positive sign. It means the lump isn't interfering with any important jobs, like controlling your face or making saliva. All right, so with all these initial clues from the exam, what they saw, what they felt, how the nerves are working, the clinician can start building a list of potential culprits. This is what's called a differential diagnosis in the medical world. I like to think of it as lining up the usual suspects. And if you look at this lineup, one suspect immediately jumps to the top of the list, a benign tumor. I mean, it just fits the profile perfectly, right? Slow growth, painless, mobile, it checks all the boxes. The other suspects, a malignant tumor, an infection, a cyst, they just don't quite fit the evidence we've gathered. There are contradictions. So right away, the investigation is starting to zero in. But you can't stop there. To confirm our prime suspect, we've got to go beyond the physical exam. It's time to call in the forensics, the high-tech stuff. We need to get a look inside that lump and see what it's actually made of. So how do they do that? Well, there's a pretty standard pathway, a logical set of steps. First, they'll usually start with an ultrasound. It's a quick, easy way to see if the lump is solid or filled with fluid. Next up is a test called an FNAC, which lets them grab a tiny sample of cells. And finally, for the really detailed view, they'll use advanced imaging, like an MRI or a CT scan. See how it works? Each step gives them more and more information, building a really complete picture. Now that FNAC, that's really the star of the show here. It stands for fine needle aspiration cytology. Sounds complicated, but it's actually a pretty straightforward test. They use a very thin needle, often guided by ultrasound, to go right into the lump and pull out a few cells. Those cells then go to a lab where a pathologist looks at them under a microscope. This is pretty much the gold standard for telling the difference between a benign, good guy, and a malignant, bad guy lesion. All right, last but not least in our evidence gathering phase is the detailed scan. And doctors basically have two main tools in their toolbox here, MRI and CT. So what's the difference? Well, think of it this way. MRI is the superstar for looking at soft tissues, nerves, muscles, glands. CT is the champion for looking at bone. In our cases, since the facial nerve is so close by, MRI is almost always the way to go. It gives the surgeon an incredibly detailed roadmap before they even step into the operating room. Okay, so let's recap. We've got the physical exam findings, we have the cell sample from the FNAC, and we have these beautiful detailed maps from the MRI. The clinical team now has all the evidence they need. The case is ready to be cracked, and a solid plan can be put in place. So, after all that detective work, after all the tests, what did the evidence reveal? What's the final verdict? The provisional diagnosis is pleomorphic adenoma. Yeah, it's a bit of a mouthful, I know. But all it really means is it's the most common type of benign, that's non-cancerous, tumor you can get in a salivary gland. And for both our patients, this is the textbook classic culprit. And really, it just makes perfect sense when you look at the evidence. The classic location, the firm but mobile feel, the fact that it's painless, the well-defined edges, and, crucially, the intact nerves. Every single clue points in the same direction. It's just a classic presentation through and through. So what's the game plan now? It's a really clear, methodical approach. Step one is counseling. The surgeon sits down with the patient and goes over everything, the procedure, any potential risks like nerve injury, and exactly what to expect. Step two is the surgery itself, carefully removing the tumor while making it an absolute priority to protect all those important nerves. And finally, step three is post-op care, just monitoring everything to make sure the healing is on track and nerve function is perfect. But is the case closed once the surgery is done? Not quite. The story doesn't end there. There's one more really important chapter, the long-term outlook and follow-up. See, the journey doesn't just stop when the patient leaves the hospital. There's a period of surveillance. They'll come back for regular checkups, especially over the first couple of years, just to keep an eye on things. The goal is to watch for any signs of recurrence. It's rare, for sure, but it's always better to be safe and catch anything super early if it were to happen. So here's the big takeaway. The prognosis for a benign lesion like a pleomorphic adenoma is excellent, especially after it's been completely removed. With a proper diagnosis and skilled surgery, the case is pretty much closed, and the patient can get back to their life with a whole lot of peace of mind.
So when you think about this whole journey, from that first scary moment of finding a lump, all the way to a clear plan and a great outcome, what does it really teach us? I think it's a brilliant illustration of what modern medicine is all about. It shows how something that seems like a terrifying mystery can be broken down, investigated logically, and solved with a step-by-step, evidence-based process that is designed, above all else, to protect the patient.